peak blood pressure right at the end. Same with lactate. It depends on who's teaching you how lactate is done. Some teachers like you to have the subject jump straddle and then you get the lactate, or some will allow the person to just continue to exercise and they get lactate at the same time they get blood pressure. Blood pressure technicians, if you are short, do not stand on a chair. That is a danger. It's a danger to you and it's a danger to the subject. If you fall off, you can take them with you. I've been through this. I am short. Stand on your toes. That's the best I can tell you if you're in short stature.
Swap people around if you have to.
Or swap people around. Yeah. If you've got someone like his size, Patrick's size, and you've got a blood pressure technician like me, I can take it because I've had that kind of experience. But if you're uncertain, swap someone around. If you've got someone who's a little taller, make them a blood pressure technician. And they can hold on. And the other thing with blood pressure is, especially with exercising, arms tend to swing. So what's the problem with having a blood pressure cuff attached to a swinging arm and you trying to take the blood pressure while that arm is moving? What's going to happen to your blood pressure? You get extra noise too, but what happens to the measure itself? Like, what are you going to see? Are you going to see it higher or are you going to see it lower? You're going to see it probably irregular and probably high because the arm is contracting. So what you want to do is grab that person's hand and lock it against you, in your armpit, against your torso, what have you. They're sweaty, you're sweaty, it doesn't really matter. We're all friends. That's right. And you're all kinesiologists, so, you know, sweat and saliva, that should all be normal stuff. So grab hold of that arm, hyperextend that elbow, and get control of the arm. Because that way you'll get a better blood pressure reading. That's just a nice little tip. That's okay.
I'm going to wash it on.
No, I wouldn't bother. Because there's a lot of like sweat marks.
Sarah's also going to say that they could hang on to the front of the tread to stabilize that arm as well.
Right.
If that works easier for you.
Yeah. Or have them hold on to that while you've got hold of their arm so you're not throwing them off balance. So they've got a way to hold on. I wouldn't suggest having to put their arm up here and that arm that you're taking blood pressure. Like if you're taking blood pressure on that arm, I wouldn't have them hold on to this while I take it. I would actually have them, I would hold on to their arm that I'm taking the blood pressure on and have them grip hold of the treadmill with the other one to stabilize itself. Okay, so once they're done, have them walk. Oh, that's what I was going to say. Okay. Person that's the technician. If you see some type of anomaly in their EKG, do not shriek and do not go, oh, check this out, that's interesting. Don't say that. You're going to make the person have a heart attack. Or that, yeah. Don't do that. What you can do is say, how are you feeling? If they say, I'm feeling good. Okay, if they look fine, if they're not pale, if they're not sweating profusely, well, they probably will at later stages in the test. I'm thinking in the first stages, because usually a lot of the time you'll see an anomaly within the first stages of the exercise test. So that's where my thought is. But if they look all right, you know, if they're okay in color and they're doing fine and they can talk to you, then obviously they didn't feel it. And you guys should all know your contraindications for stopping a test, right? You guys all know those? I see blank faces.
Just had a test on it, I hope so.
Aneurysms.
Exactly. Basically, if their EKG is throwing out anomalies left and right, stop the test. Yeah. If their blood pressure is super, super high, stop the test. And blood pressure you kind of want to be careful with. That's the other thing. If they've got a high blood pressure before they even start, a lot of the time you can, you know, chalk it up to anxiety. However, if they're not that nervous and it's really high, it could be that they haven't had enough water during the day. And so I would probably hold off doing the test until they had enough fluid in them where their blood pressure has come down. So. All right. They've been on the treadmill for a while. Their heart rate's come down to about 120. And they feel okay. They're ready to get off. let them know that you're going to stop the treadmill. Don't surprise them.
Oh my gosh.
I've seen that happen. Oh, the other thing is too, blood pressure technician post 3 and 5 after the test is done. If they're still on the treadmill after 5 minutes, take it every 5 minutes thereafter until they sit down. Take one like a minute or two after they've sat down to be sure they have an appropriate response. So you're going to click on stop treadmill. Once you say, okay, I'm going to stop the treadmill, we're going to get you down, click stop treadmill. That stops, they sit down, have them dorsiflex their feet. If they are short, have them sit at the edge of the chair so their feet touch the ground and have their feet do this on the ground. Don't let them do it in the air, just do it against the ground. Alright? So we're not going to click stop yet because our EKG we want to keep. That's how we're going to keep track of how our subject is doing. So once they're seated for a while, like I said, take a blood pressure. About every 5 minutes. Doesn't have to be every 5 minutes, especially if they're doing okay. You can probably say blood pressure is done. You're fine. Take one more blood pressure before you unhook them, just to be on the safe side. Once their heart rate comes down to about 110, if you can get a lower, fantastic. About 110, then you can disconnect them from everything and they are good to go, as long as they feel all right. So after they're done on the treadmill, some of the things you really want to be wary of, especially if they've exerted themselves a lot, ask them when they're done, are you okay? Yeah, I'm fine. Do you feel dizzy? No. Do you feel nauseous? Yes. If they feel nauseous, go send someone for a trash can. People do throw up, and that's the other thing you want to mention to your subject before they come in. Don't eat within a couple of hours prior to the test.
Oh, I just have to bring this up because she gave this talk in the 10 o'clock class. Kelsey's husband's in the military. They decided they're doing their training today. And so he had just had a huge lunch, and they're going to do the max testing. Oh. And she's like, no, you can't. I just heard you just can't do that. And so, in fact, his sergeant got on the phone with her. He goes, oh, why can't he do it? There's nothing wrong with it. He's like, yeah, but he's going to puke. Is that really what you want to happen? And he's like, no, it'll be fine. It'll be fine. She's just like, okay.
Good luck.
Yeah.
Usually, a good way, or just tell them within a couple of hours, don't eat. If they have to eat, make sure it's nothing really heavy, and make sure they drink plenty of water prior to the test, or you'll have that problem with blood pressure. Now, if you've got someone who is now in the seat, in the chair, but their heart rate is staying above 120, they're at 130 again, and dorsiflexing their feet is not bringing the heart rate down, give them more water. If it's still not coming down, you can try ice packs, or you can try a wet towel. Don't put it on the back of their neck, stick it underneath their arms. See if that works. I've had to do that, I think, one time.
Why do you say don't put it on their neck?
Because you can make them pass out. Yeah. If you stick it underneath their arms,
Too late.
It's got a little bit of time before the blood cycles back up to the head, and that way
Battery's
you're
gonna
not
die.
dropping their temperature too quick. Yeah. So underneath the arms is fine, and never stick ice against skin, ice to skin. Always put like a paper towel around it or a piece of cloth around it before you do that. That's just safe practice. All right, that's it for Maedgraphics. Does anybody have any questions?